Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where we're joined with Chairman Kern and also again today Barb Hope, Director of the County Health Department. Barb, appreciate you. I know you just came from Kaysville and you're running a candle to both ends there.
But yes, we are, like all the rest of us are, and whatever it takes to try to keep Team St. Clair safe from the COVID. So today the updates on the numbers are: we have an increase of 641 tests that were conducted, and of those 641, we had 63 positive cases. We have tested a total of 32,770 cases. Of that total, 3,593 were positive, with 29,173 negative. We're very happy to report we have no additional deaths. And lately, we've seen the trend over the last probably 4 to 6 weeks that very happy to report our death rates have slowed down. And those that we have had over the last month to 6 week, majority of those are folks that are elderly, 70, 80, 90 years of age and up, typically with underlying health conditions. So we are winning that battle, ensuring that people are not dying from this disease. However, as we'll see today, and we've seen over the past week, 2-3 weeks since 4th of July, the highest incidence of positivity is from folks between 20 and 40, 20 and 50 years of age. So again, even though you may not feel bad, please wear your mask and ensure you do the social distancing and wash your hands. Statewide, we had an increase of 1,076 positive cases. Total, we have tested 2,570,465 in the state. Of those, 173,731 were positive. Today, however, statewide, we had an increase of deaths to 30. That's an increase from yesterday. We had 18 yesterday. Again, I don't have the details on those 30 deaths. We can have that in the future, but again, that's way too many. We reach out to those family and friends that have lost anyone due to COVID. So our sympathy goes to those families. The good news is today we don't have any changes, no additional cases or any deaths in any of our congregate living facilities, so that's very good news. You know, the state mandated routine testing for the staff as well as the residents, and that's working. We're making sure, and that's how the old isolation and quarantine system works. If someone tests positive, let's take them out of the community, let them heal, not transmit disease, as well as those that they may have been in contact with, and quarantine those individuals. So it appears to be working for our long-term care and congregate settings. That's what we do as we do our community testing. And speaking of community testing, I just got back from Kaysville. They're still testing at the park. They have, it's completely drive-through. You don't have to get out of your park, sit in your air conditioning. They had over 220. They've tested so far today, and they're still open till 4 o'clock. Yesterday, we tested 240 in Millstadt, which is great. The rest of the week, we have more test sites available. Again, all of these are from 8 to 4. Tomorrow is Mascoutah at Chevy Park at the great big ag building, and that will be rain or shine because, again, the individuals can sit in their car, and then we'll have a drive-through through the great big ag building that everyone will be under cover. So rain or shine tomorrow since they're forecasting storms in Mascoutah at Chevy Park in the ag building. On Thursday, we'll be in New Athens at the Oak Valley Park there. On Friday, we'll be in Lebanon at the True Value Pharmacy. And then Saturday and Sunday we'll be at the Bevel East lower parking lot. All these days are 8 to 4. And one other thing I would like to add, we saw some reports and had some phone calls that some folks are experiencing phone call scams associated with contact tracing. I can assure you that when staff call, now they may call from a burner phone, we may not say come up St. Clair County Health Department. If they're calling you in the evening, we have given them burner phones to call individuals. Obviously, for those people that are working, we can contact you in the evening. We will never ask for money. We will never send you a home test. We will always introduce ourselves as our name and that we're with the St. Clair County Health Department. We'll leave a return phone number if you would like to call us back. And when you call back, pay attention to how they answer the phone. Make sure they say St. Clair County Health Department, and they will identify themselves. So again, please be very, very wary about phone scams, not only with contact tracing, but there's a lot of it in our community of everything. So, but we will leave a message to say call us back, and we'll give you that phone number, and we'll identify ourselves as the health department. Again, we never ask for money. We never say we're going to send you tests through the mail. So please don't respond to any of those. And again, follow the 3 W's. And with that, I will turn it over to our chairman, Mr. Mark Kern.
Thanks, Barb. Let's just chat a little bit. Hospitalizations, 41. That number is remaining pretty consistent.
About the same,
It's
I think.
higher than it was.
Right.
We had gotten down below 20, so that's we don't like that number. But let's talk about for a minute. So, congregate living facilities now we had no changes, and that's a great thing. But what that means is we really, when we see these increases now of 63 today, that's really community spread. So
Yes.
In congregate living facility numbers, which were high at one point, that's confined to that particular place. But now we're seeing this throughout the county.
That's right.
And under 40 seems to be about half of what the community spread is. So that is a concerning thing.
Absolutely. And again, folks, don't have any symptoms. They feel fine. They have no headache, no fever, no anything, and they can be symptomatic and spread it within our community. And not only, to their own families, but to their coworkers or anywhere else. And this is an absolute example of that. There's community spread disease in our area. So please get yourself tested. And that's how the whole system works. If you test positive, we want to take it out of the community and quarantine or isolate folks, so let that virus die out. And any of those folks that could possibly, if they stay in the community, they continue to spread it. And it's exponential from one to the next, to the next, to the next. So,
And it is resulting in increased hospitalization. So it isn't, we're lucky on the deaths. That number seems to have been arrested pretty well now, knock on wood,
right.
but the hospitalizations are increasing. So just because you may not have symptoms, you can give it to someone whose immune system may not react like yours.
Right. Or they may be healthy too and not realize it, and they can become asymptomatic. So it goes from one, now you have 2 people, and how many folks do those 2 people touch to make it 4? It grows exponentially.
So that's why we got to use the 3 W's.
Absolutely.
Chairman, one thing
Absolutely.
I want to hit over the head a little bit more is our deaths. We talked about them, and I appreciate that, Barb. That's good news. Our deaths here in the county are down, but we saw, and you pointed that out yesterday, there was 18 in the state. Now it's back up to 30, so we don't want to have any false hopes there. And one of the things I think is the chairman pointed out, and you did too, in our long-term health care facilities, that seems to have stabilized, but we don't want to lose track. We've got 41 people that's in the hospital for COVID reasons, and as we all know, that could turn. Any of them could turn and go the other way. So we don't want to lose false sense of hope about our deaths. I mean, I'm happy, tickled to death that we haven't reported any, but we are watching them. We report them every day. So
Absolutely. And again, typically, historically, it's the folks that have died had underlying health conditions. But again, young folks have underlying health conditions as well. And I'm sure that any family member or a youngster doesn't want to take it to their parents or their grandparents or anyone else in their community. Okay.
Thank you, Barb. So we'll move into the zip code report for today. These are the number of COVID positives in St. Clair County zip codes. So in 62059, we had 9. 62201, we went up by 1 today to 174. 62203, we went up by 3 to 146. 62204, we went up by 5 to 109. 62205, we went up by 2 to 139. 62206 went up by 10 today to 323. 62207 went up by 3 to 196. 62208 went up by 6 to 224. 62220 went up by 2 to 284. 62221 went up by 3. They're now at 308. 62223 went up by 3 to 147. 62225 went up by 2 to 16. 62226 went up by 7 to 363. 62232 went up by 2 to 75. 62239 remained the same at 35, as did 62240 remained the same at 13. 62243 went up by 2 to 23. 62254 went up by 1 to 114. 62255 went up by 1 to 11. 62257 remained the same at 19. 62258 went up by 2 to 49. 62260 remains the same at 39. 62264 remains the same at 65. 62269 went up by 7 to 232. And 62285 went up by 1 today to 30. So all week we've been addressing issues with the schools and opening in the fall. And today we're lucky enough to have Dr. Darcy Benway, the superintendent of O'Fallon High School District 203. Welcome, Darcy.
Thank you so much for having me today. I'm excited to tell you what we're doing.
Well, sounds good. Well, why don't we just move into this? I think you've got a very nimble plan, it sounds like. How about laying that, what's the fall going to look like for your students?
Well, the beauty of our plan is that it was designed so that it can ebb and flow with wherever the COVID virus tends to take us. So whatever direction we have to move, whether it's more into remote learning or whether it's more toward in-person learning, our plan's designed and our teachers are ready to make those moves and shifts really on a dime. Right now, the plan for starting in August, and that is of 3:30 on July 28th, would be that we're going to do a 50% blended learning model. We actually are starting off by breaking our students into groups A, B, C, and D. So each group will have approximately 25% of our student population. We know that some of our students are going to be remote learners because everybody in our plan has the option to remote learn. But of those, we're going to have groups A and B come on certain days, and then groups C and D come on other days. While groups A and B might be learning in person, groups C and D will be learning remotely the exact same lessons from the exact same teachers on the exact same day. So I guess the beauty of the plan is that the content's going to be consistent day to day, regardless if you're in person or remote. And if by chance COVID numbers continue to increase, which we certainly don't like the trends we're seeing. And so we know we may have to pivot from this original plan that I'm talking about today. But we could go to a 25% model very easily and have groups A come on one day, B, C, and D. So that would allow at least one day of in-person instruction for all of our students should they desire to have that. Another key component of our plan that I'm pretty excited about is the special education and the at-risk learner component. And we certainly let the individualized education plans guide when students need to come into class and when they don't. But if we notice some at-risk learners under the 50% blended learning model or under the 25% blended learning model, and it's just not working, teachers can reach out to those individual students and families if class sizes allow and invite students to come in maybe more often so that they can get the educational platform they need.
So what percentage of students are just going to opt to stay home? And is this on a quarterly basis that they can opt in or out,
Right.
or is it for the whole semester?
We've asked our families to make the decision for a semester. In a high school, your curriculum is really semester-based. And so from an administrative point of view and perspective, to try to keep our students in line of where they need to be, it just makes sense to do it on a semester basis. The survey that we provided to our parents during registration has indicated that about 20% or 1 in 5 families have opted the remote learning option in totality. As I said, other families, if they truly need additional learning, they can reach out to the administration. So our plan is trying to meet the needs of all families, whether it's 100% remote or a family that needs more in person than maybe the standardized blended learning plan initially provides.
So you've got an interesting concept with marking of the desks. Maybe explain how you're going to keep your students safe with the touching environment that goes on in school.
Well, safety has to be first. Certainly throughout this entire process, we're balancing safety needs of students with the educational needs. But in our classrooms, if you'll picture a typical high school classroom with rows of desks, and each desk is going to be, the first row will be marked, the first desk will be blue, the second desk will be marked gold, blue, gold. Obviously Panther colors. And then in the next row, it'll be gold, blue, gold, blue. So we're creating that checkerboard pattern. And then what we'll do is students who are coming into class on the odd number periods, so first period, third period, fifth period, seventh period, they'll sit at the blue desks. And then at the conclusion of class, those desks will be sprayed down with a disinfectant that once that disinfectant dries, it would clear the desk of any potential, COVID, germs. And then for second period, fourth period, sixth period, and our early bird period, those students would come in and sit on the alternating desk, the gold desks. So that way it gives a desk a full period to dry and be disinfected. It also helps with the social distancing and spacing requirements that are going to be needed to keep that 6 feet of distance so that should we have an incident of COVID in our schools, that it would minimize the number of students that are going to be impacted and have to be self-quarantined.
And protecting the teachers will be...
Well, that's number one. You're not going to have much of a school if you don't have your faculty and your staff members protected. So we're working with all of our teachers. Some rooms will be configured where there'll be some plexiglass shields that will separate the students from the teachers. But most of our classes are big enough with the reduced class size under the blended learning model, under the 50% blended learning model, we feel that we'll have somewhere between 10 to 13 students in a classroom with the teacher, and that would offer plenty of space for that social distancing to keep the teacher safe and the students safe.
So some kids are going to see the teacher live in class. The ones that are remote, some will see a live feed, and others might see a recorded feed?
Yes, we purchased cameras for every classroom, and so our teachers have that option. And many of our teachers are choosing that option to do the live streaming of their lecture. That's a very simple way to make sure the content is consistently provided to both the remote learner as well as the in-person learner. I'm not going to pretend that a remote learning experience can be replicated with just a camera, because it can't. That in-person instruction certainly makes the difference, I think, between the highest quality of learning you can get K-12 to not. But with that being said, many of our classes, they will be doing the live stream. In some of our classes, that doesn't make sense. Let's take a biology class or a science class where maybe when the students are in person, they're going to be hands-on doing a lab, while the remote learners will be doing either prep work for the lab or post-lab work. And then they'll switch the next day. So each class is so unique in a high school setting, and each of the curriculum related to the class is so unique that really the autonomy of the teacher and how to get that instruction to both the remote learner as well as to the in-person learner, it will be a little bit of a challenge, but I think we got it.
What about for kids that don't have the technology necessary? Is that something you provide?
Well, I'm very thankful for the CARES Act money that came through to our school. And I'm thankful for our Board of Education, who over the years have been very fiscally responsible. So we had reserves back in March when the original call was made that we were going to have to go to remote learning, and we didn't know what that was going to look like or how long that was going to be. We had reserves in our bank accounts where we could go and immediately purchase technology for our students. So we purchased tons of laptops, tons of hotspots, we purchased cameras. The CARES Act money came in that even supplemented that more. And O'Fallon is a pretty network connected community. We don't have a lot of dead spots in our community, so we think that we're going to be able to meet the needs of those students, technologically wise, I guess. And the other thing, if there is a student that just lives in a remote place and there's no way that remote learning can occur, under this blended learning model, that student could come in more often if we needed to do that. So that would be on a case-by-case basis as well. We are not going to let any student not receive the education that they need.
So it sounds like the system that you have set up pretty much can accommodate any situation, any range of COVID that's going to exist, and any needs that the students might have.
Well, I hope so, but you know, there's always something just waiting to hit you that you didn't think about. But the blessing of this plan was that it really came from the grassroots efforts of our teachers, and they're the ones that are in the trenches. They're the ones that are dealing with the issues and the student learning challenges that are out there. So when you have a big committee of your educators and your support staff, and include counselors and librarians and just the mix, everybody puts their brain in gear, and you really come up with something pretty special, and I think that's what we've done.
Temperature taking, mask wearing?
Mask wearing is a must. There's no exceptions to that. Temperature taking, in a school our size, the logistics just doesn't make temperature taking feasible. So we are going to have our students, their parents are going to have to self-certify them that they've taken their temperature, and they go through a questionnaire before they would arrive. But masks are a must.
And if a student says, I'm not going to wear a mask, and they don't have a medical reason for saying that, then they're pretty much going to be learning from home.
Well, we're going to do our very best to convince that student otherwise, and to work with that student and to provide the rationale of why it is their responsibility to wear a mask, and hopefully convince them to participate. If they don't, then for the safety of the other students and for the safety of our faculty and staff, we'll have to ask them to engage in remote learning for their education.
And how about clubs and band, chorus, those type of things?
As long as the numbers would allow us to do so safely, we will do so, and have our students participate in extracurriculars with all of the safety precautions, the social distancing. We make sure they wash their hands before they get, pick up their band instrument, wash their hands afterward, masks, all of those types of things. If we can continue those extracurriculars, we know that student's participation in those things help to keep a student engaged and help to keep them connected to their school. And if they're connected to their school and they're more engaged, they're going to have a better learning experience. So we think that's important to the extent that we can, to try to keep students involved to some level in extracurriculars and sport.
And sport, I guess, tomorrow, or is that when the announcement's going to come? So I think most districts are waiting for the state's guidance.
That's my understanding, is the IHSA will be meeting and will be making some sort of an announcement tomorrow. It would be surprising, given what you see in the national headlines with other sporting events that are going on, that high schools could have sport. But if we don't have sport, we encourage our coaches to still be meeting with their athletes to do what they can, again, trying to keep our students engaged.
Well, I appreciate it. Sounds like you've been hard at work all summer. You didn't get much of a vacation out there.
What's a vacation?
Herb knows all about vacations. Herb, okay. You got
Dr.
anything?
Benway, thank you for coming in today. Before we went on with the briefing today, and we were talking, I'm impressed with the plan, but what I was impressed with is you're watching the numbers every day. And this plan sounds like you've got a backup plan in case what we don't want is those numbers to go up. But if they do, you're going to still be able to make sure our students are taken care of.
If there's any information that I can get across to our families out there, it would be flexibility. And that means that if the numbers are taking us in a direction, we're going to move there. So just because, as I said today, this is the direction we're going, we have to be prepared for complete remote learning or a 25% model. If the numbers would really improve, they're talking about vaccines. If we can get vaccines going and numbers really turn out great in the late fall, early winter, and we can bring more people back in person, We want to have a plan that can ebb and flow to provide the best opportunity for our kids.
And it sounds like from what you've explained here this afternoon that you're ready for that. So
Ready.
we hope the numbers go down and we keep it there to where you can get those students in there. Brian, there's some questions that come in.
Yeah, just one question that you guys haven't really talked about yet. Is there any modification to the time that school's occurring? A lot of the districts have announced shorter days or earlier starts. Is there any modification to your timetable?
Great question, and yes, there is. A high school our size, we recognized right off the bat that there were 3 areas where we were going to struggle with large groups of students getting together. Cafeterias were one. So by reducing the hours in the school day and having students be able to take grab-and-go lunches and not have to eat in the cafeteria, that took care of that. The other 2 places, hallways, we know that students want to congregate in hallways, so we have plans in place, directional signage on our hallways, maybe even some one-way hallways or some dead-end hallways where you can't go that way, in order to deal with the potential congregation there. And then the last place was the buses. By reducing the number of students, we think we've got the bus situation also figured out. So those were the 3 areas that we really focused on.
One other question I just saw come in here says, how can you play an instrument with a mask on? I'm sure the instructors, the teachers are going to be dealing with that.
Any instruments that are being played, we're doing that outside. So outside with even increased social distancing, because we know the spittle that can occur when you're playing a musical instrument. So we're being very careful. If you drive by OTHS on any given day, you'll see students, and they might look close together, but there's actually painted X's on the grass and on the ground that are keeping them at an appropriate distance so they can engage in playing their instruments.
Well, and that's what, ask your questions and we're going to get you the answers right here. So we appreciate that. Thanks, Doctor. And no other questions I saw, so we really appreciate you coming in today.
Thank you so much for having me.
Thanks, Doctor, very much. You could probably fit a harmonica under your mask, Herb.
Couldn't play it, but I could fit it there. These days are just running into one another. We had 41 agencies come in today for the PPEs, which we continue to supply that to them, and we're just fortunate we're able to continue to do that. The regional positivity rate as of July 25 is 7.8. And when I called you today with that, you didn't answer me right away. But
We really didn't expect, we know the numbers are rising, but that's a pretty significant increase from yesterday to see that, and it is not very far to that 8% level where 3 days of 8, and we're back to where we were in June.
But and I just, because a lot of our Team St. Clair members, they're following the state site, they're following us, and it didn't take them long to start posting that on the page. As we say all along, we're watching it by the hour sometimes. My staff here gets kind of aggravated when I say, have we got those stats in yet? Because I want to know. So we're hoping over the next 2 to 3 days, we're going to see that get back down a little lower. We've been fluctuating at 6.8, 6.9, and now we jump up to this. So.
And when we say we, it's not just
No.
but we as a region. So
Yes.
we've got a lot of counties that we're with. I talked to the chairman of Washington County today. Everyone has concerns.
Well, and that's what I think is important, because when we follow these comments on here, which we do all evening long, it's just not what we're talking about on the regional level. We've got to take in all the considerations from all around, and that's what we're doing. If you're thinking we're just sitting here just worrying about right here, I wish that's all we had to worry about. I wanted to touch bases again. We got a good response. We announced yesterday the Code Red system. People texting us today saying they went on and signed up, and that's easy to do. It's on our page. You can go on there. Also to www.alertstclair.com. That's the Code Red. Channel 2 had an article on it last night. It stirred a lot of interest on there. So get signed up for that. That's the mass notification system here now, countywide, along with the other 14 municipalities that already had that in place. So we're really happy about that. The other thing I want to talk about, I talked with the mayor of East St. Louis today. He's doing better, as we know. He was feeling ill there for a couple of weeks, and he said, passed word on to you that he's back out there promoting what we're trying to do. Also, they're taking an initiative, closing down their businesses starting at 10 p.m. He just said that they want to get the word out there for the people.
The liquor establishments,
Yes.
because with St. Louis and St. Louis County closing at 10, that means then there are some people that might be looking for another place to go. And that is the worry, that problem gets pushed to communities that are open.
Right. And I want to give a shout out to Mayor Roach of O'Fallon. He put out a PSA video today, just basically pleading, begging his constituents to let's don't go backwards. So I really thank Mayor Roach for doing that. And all the mayors, as you know, I tell you every time one of them's called, and the messages that they're trying to get out there, because it is Team St. Clair. We're in this together. 63 new cases yesterday. We keep hoping the day is going to come where we'll come in here and say 0 on everything, and we flip that light switch, and we're all going to get back to normal. Hang in there with us, Team St. Clair. Share these videos to your friends, neighbors. Remember the 3 W's as we all preach to you. We'll be back here momentarily with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back here approximately tomorrow at 3:30 for your next update, and hopefully some better news on the numbers. Have a good evening.